Learning medicine is about patients first. You'll never learn to be a good doctor unless you see a lot of patients and take responsibility and ownership for those patients. The most important thing I've ever learned from a clinical mentor is how to listen to a patient. You don't just listen with your ears, you listen with your eyes. You watch the patient's eyes, you watch the patient's hands, you watch the patient's family member. You listen for the things the patient says and the things the patient doesn't say. Search for the truth begins with really listening and then exploring and figuring out, why is this patient here? Every good clinical question starts at the bedside. That's why we call them clinical questions. The Department of Emergency Medicine has tremendous resources to help answer those questions. We have very good medical records. We have statistical support and research design, an animal lab, and other research facilities, so that when you're standing at the bedside, not sure what to do for a patient, we have the resources to go in and dig and develop an answer that didn't exist before. Everyone who has an interest in research wants to start big. They have big dreams, big ideas, but the problem is that big questions aren't answerable questions. You've got to break it down. The most important step in research is to figure out exactly what is not known, and then take a small chunk right at the edge between what's known and what's not known, and figure out how to tackle that small piece. We have people here who are world-leading researchers in lots of different aspects of emergency medicine, some very close to the clinical bedside and some more basic. We have so many tools that you can come at a question from 3 different directions at once and really pin an answer down. For me, and I think for most of my colleagues, mentoring is what keeps us going. Teaching, where you sit with a one-way flow of information, is satisfying and rewarding, and it's something we need to do. But mentoring, where you serve as a role model and you teach people the behaviors and the mindset that lead one to be an excellent clinician, a doctor you can trust, a colleague you enjoy working with, that sort of thing is really important to me and important to everyone I work with. If you're on a clinical shift, be passionate about the care of the patient in front of you. If you're doing research, be passionate about finding the answer to that clinical question, so the next shift somebody else can take better care of his or her patient.